Hey there, this is Dr. Bob McIntosh, Health Source Chiropractic, and I'm talking on our condition of the week today, and this next one is going to be earaches, and I'm going to switch this over here. Ear infections and earaches, or another word for it is otitis media. And so what ends up happening with it is the ear infections can actually build up inside of an ear and push out on an eardrum. And then when you stick your finger in your ear, there's a canal that goes out to the ear itself. So that canal comes in, there's an eardrum right there, and then you can the fluid can fill up in this area here, and then all of a sudden the eardrum can rupture itself. So some common symptoms are going to be pain or fever or irritability and crying, those types of things with kids, but also with adults. It's kind of that sharp ear pain up here, or pressure on the ear kind of feels muffled. And so what ends up happening is you think that, all right, what do I do to take this pressure off? So number one is your body can rupture that eardrum, or else it can find another path out, and the normal path is the eustachian tube. Eustachian tube blockages are the primary reason for ear infections. Okay, so number one, how do you take and reduce the blockage within the eustachian tube? It's not antibiotics at all. So antibiotics have been found only effective to treat 15% of ear infections. But they've also been able to prove that antibiotics can cause diabetes and superbugs and a lot of other things out there. So that alternative is not the primary method to be able to treat ear infections. I've had to send patients in to help calm that down while we're working on the cause of it. So an ear infection is that blockage on the eustachian tube from that canal or that area of fluid where it's filled up. If we can take and straighten that tube out, pull the blockage off through a chiropractic manipulation of the spine, or through in the mouth, a transoral manipulation of the eustachian tube, we can actually take the mucus plug out of the way and drain that ear, so there's no infection then. So it's like a hot tub, basically. If you fill up the hot tub, you're going to have a party, right? So if the hot tub gets full, or the eardrum gets full of fluid, or that blocked up eustachian tube, what's going to happen? One bug hops in there, and it turns into a party, because that one bug will make more and more and more and more bugs, which will take and create pressure and pain and inflammation, and then pop the eardrum. So how do we get it out? The main way is take and go to the chiropractor. So I am very specific in adjusting this, and I'm very good at being able to help people understand the cause of it and also what the effects are. But what I can also tell you is I can take and when I take in and go and treat a patient with this, is their results can happen within an hour of complete resolution of the ear infection. So it's very effective. If you or anybody you know has ever had an ear infection, make sure they give us a call and we can help. So I'm Dr. Bob McIntosh, Health Source Chiropractic, and we'll be able to find a way to be able to help you, I hope. So have a great week. Hope you learned something.